The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name is Mark Ryan, and it's a pleasure to be hosting the podcast. And thanks to everybody for listening in. Today, we're going to talk, again, one of our favorite subjects, Medicare Advantage. We're going to talk a little bit about the fact that Medicare Advantage is under siege on Capitol Hill and at CMS, but a recent brand new analysis or study that basically shows how valuable MA is actually to the Medicare program as a whole. So we'll get right to it. We'll take a couple of breaks to divide it up. But the first area that we want to focus on today on the podcast is really, why is MA embattled and what are some of the issues that are being raised? So the MedPAC, the congressional policy arm for Medicare, many anti-MA researchers, some Democratic lawmakers, and actually even some GOP lawmakers are really questioning whether Medicare Advantage is paid too much. And this is sort of broken down in a number of different ways. Holistically, many of these researchers in MedPAC, as an example, have studies that suggest that MA is over-reimbursed by a wide range of areas, but some of these dollars are just fanciful. Some would say it's $20 to $40 billion per year over-reimbursed. A latest figure says about $80 billion per year, and I've even now seen some figures over $100 billion. Now, they sort of throw the entire kitchen sink into this when they talk about these numbers of 80 and above. They question the fact that Congress made a policy decision to reimburse certain counties greater than fee-for-service. That was good policy meant to incent MA plans to go into rural areas to promote choice. They question why the STAR program is not budget neutral, but additive dollars. They talk about overpayments, again, from risk adjustment. And in the case of risk adjustment, they argue that there's overcoding. They also talk about beneficial selection in the program. And they also question whether supplemental benefits are working and whether the utilization against the bids that are submitted is really there. So when you take all of those issues together, some are saying $80 to $100 billion, too much spending per year for MA. Now, again, I discount a lot of that. I do believe that some reform is needed, especially on risk adjustment. I believe that perhaps diagnosis codes that only show up on health risk assessments or manual chart reviews should be phased out, because a plan should be able to get a doctor, one of their providers, to submit a diagnosis if it's true on an encounter or a claim. So some reform may be needed, but definitely MA is under siege on Capitol Hill and at CMS as well. I will also tell you that CMS and to some degree Capitol Hill is going down a road of really restricting the use of prior authorization in Medicare Advantage. I think that's a terrible policy. What is managed care but limiting healthcare expenditures? Sometimes that's done by working closely with doctors and care managing and things like that. But also prior authorization up front should not be a bad word. It's meant to curb excess in the system. Doctors are now primarily owned by hospitals and health systems, and these hospital and health systems unfairly drive costs. So limiting things like inpatient care and other facility care, which is very expensive, is not unreasonable if it's not medically necessary. A brand new 2024 rule from CMS actually takes the managed care out of managed care. It basically says that Medicare Advantage plans have to follow the same rules as fee-for-service, and providers are in the driver's seat when it comes to deciding whether somebody goes into a hospital or goes to a post-acute care facility for recovery. And again, that is going to add tremendously to cost as well. Right now, MA plans are in rough financial shape. A combination of low star scores, which is in part related certainly to plans, but in part related to how CMS runs the system, as well as inflation and utilization returning to the system, as well as these PA rules and other restrictions, have really seen a cost surge within Medicare Advantage. On the revenue side, a new risk model was put in place that has meant that for 24 and 25, and likely in 26, rates will be essentially negative. So the combination of low or negative rate increases, as well as all these other constraints, and admittedly some poor management by MA plans, has led to a crisis in terms of margins for the industry. And so right now, for the 25 benefits, many of the large plans and even some medium and small plans have contracted benefits. There's as many as 2 million people that will have to change plans because many plans were sunset in given markets or given products in markets. And it really is a very challenging time for MA. With that introduction as to the challenges, as well as some of the opponents' attacks on MA, we're going to take our first break, and we'll be back to talk about some optimism that we have with President Trump coming in and what MA could look like moving forward. Again, optimism and perhaps some continued negatives. But we'll be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. My name is Mark Ryan, and it's a pleasure to be hosting the podcast, and thanks to everyone for listening in. We're talking about some of the challenges of MA, and in the last third of the podcast, we'll talk about a brand new study that really shows the benefits of MA. But right now, I promise to give you a little feel for what MA could look like under the returning Trump administration. So I think it's going to be a bit of a mixed bag. I don't think it's going to be a perfect system. It's very clear that Donald Trump really favors Medicare Advantage. And there is some talk within the incoming administration, as well as at think tanks that are philosophically aligned with Trump, like Heritage Foundation and the Paragon Health Institute, that Trump should be very pro-MA to promote the program and to promote more and more people coming into it. We already know that the program has grown demonstrably because of the difference in value that MA provides versus the traditional fee-for-service program. In essence, MA plans can deliver care at less of a cost for traditional Medicare benefits. And the way the rate setting in the star bonus system is done, you then pass on more benefits to consumers, and consumers love that. And they're flocking to MA, especially those of low income, because the traditional Medicare benefit has huge holes in it. So MA is growing in and of itself, but the talk is that Trump will promote MA even more under his administration, Trump 47, as we're beginning to call it. We'll also note that some conservative think tanks on healthcare have said that perhaps Medicare Advantage should become the default option for seniors when they sign up for care. Don't allow them to enroll in the traditional fee-for-service program. As a default, tell them they have to join an MA plan, and only if there's not sufficient coverage where they live or something like that would they be allowed to enroll in the traditional Medicare Advantage Medicare program. So that's something that could occur. I tend to have my doubts about whether the country is ready for that, substantially because of the current crisis we have financially in MA. But we have seen some pullouts in rural areas, and networks and things like that might not be fully built out. I think we could take a two-step process on this where there are greater incentives for MA plans to grow in suburban and rural areas. And then over time, as choice gets even better, you could make MA a default option. The rural areas have seen a huge increase in penetration. It is going back a little bit in 25, but we've made great progress. If you did put additional incentives in place, that would really help going toward a default option. But I'm a little skeptical about whether Congress is ready to do that immediately. But nonetheless, the incoming Trump administration will probably promote MA in a big way in so many different ways. One of them could be some initial rate relief because of the struggles of the industry. Before the break, I told you that there's a new risk model being phased in that has caused rates in 24 and 25 essentially to be flat or go down. The third portion of that risk model is being phased in 26. And whether that moves forward or not under a Trump administration has to be decided in the first few months. Will the Trump administration potentially forestall further phase in, the last third of that risk model phase in for 26, and give MA some rate relief? I hope he does, because I think the industry needs it and the country needs it, because we have far too much displacement right now in the program, with about 2 million people having to change plans for 25. But we'll see whether that happens. They are looking for budget savings to renew tax cuts. So that might mean the last third of the risk corridor is phased in. In total, the entire risk model change over a 3-year period is a reduction, by my estimation, of about 7%. So it's quite big. But will that occur in this time frame in the first couple of months? We don't know. But many people are hopeful that some relief in 26 rates will be given to MA plans. Now, on that note, I also want to say, though, while I do believe Trump will be far friendlier to MA, I do not think all of the scrutiny will simply go away. As we pointed out before the first break, there are overpayment concerns, there are STAR concerns, there are supplemental benefit concerns. And I think these concerns will continue to be issues at CMS and on Capitol Hill. There's a little anti-corporate welfare mentality on Capitol Hill among both Democrats and even Republicans. They feel if private entities are overpaid, that's essentially corporate welfare. So you could see Congress continue to weigh in on overpayments. You could see a restructuring a bit of the STAR program, perhaps, on Capitol Hill. You could see greater scrutiny over the spending on supplemental benefits and whether we're getting value from these benefits in the rate structure. CMS could also continue to look at reining things in. Perhaps changes in these areas will be less than what they would have been under a second Biden administration. But I do not believe these things just simply go away. I think, given some of the sentiment on Capitol Hill, and again, trying to find savings in the program, that these reform areas will probably continue and probably be implemented in some way. So, in summary, a Trump administration will come in, be a lot friendlier to MA. They like the program. They think it's the future of Medicare. They could give some rate relief in 26, but I do believe that in the next 4 years, you will continue to see some scrutiny and some reform implemented along the lines of overpayments, risk adjustment star, and supplemental benefits. With that, we'll take our second break and we'll come back and tell you about an exciting new study that I really think shows how valuable Medicare Advantage is to the healthcare system and the Medicare program as a whole. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. My name is Mark Ryan. It's a pleasure to be hosting the podcast, and thanks to everyone for listening in. We're talking about Medicare Advantage today on the podcast, some of the challenges that Medicare Advantage is having right now, some of the attacks on the program, as well as the fact that we could see some better treatment of MA under the Trump administration, but that we probably will continue to see some reforms. So let's get to this study I told you about that proves the huge value of Medicare Advantage. First, I always tell you that MA is far more efficient than the traditional and antiquated fee-for-service program. MA plans bid a percentage of the fee-for-service cost to deliver those fee-for-service benefits. And across the nation, that bid is about 80 cents on the dollar. So there's a 20% discount built in, showing that Medicare Advantage is far more efficient than the traditional fee-for-service program. But what this study does, it goes even deeper in terms of the value of MA, and it really counters the overpayment headlines we see from the opponents of MA. An Elevance Health study shows a derivative value from MA penetration. It says the growth in MA leads to lower overall Medicare spending as a whole. The study found that Medicare spending was $431 billion less from 2010 to 2020 than the Congressional Budget Office predicted. Even accounting for risk adjustment payments factored in, the savings over that roughly decade time frame was about $116 billion. Now, as you know, I think the overpayment numbers are way too big, but at the very least, in that decade period, there was between $116 billion and $431 billion in savings in the program overall due to greater penetration of MA. Now, some would argue that could simply be wrong estimates from the CBO. But the authors of the study find that the difference in the CBO estimates and what actually happened was on a per enrollee spending basis, not in the gross sense during that time frame. Researchers also found that a 10% higher MA penetration in a county points to a 1.9% decrease in Medicare spending overall, correlating to a 204 decrease in per person spending. This resulted in up to $144 billion cumulative savings from 2012 to 2021, a slightly different time frame. MA enrollee spending was $500 less per person than traditional Medicare enrollees. So what does this all really mean? Well, what appears to be happening is that as MA grew throughout the period, managed care principles in MA appear to have influenced spending in the traditional fee-for-service program. Managed care is paid on a capitated basis by the federal government. It is at risk if it does not control costs and in part drive quality through the STAR program. While fee-for-service or transaction payments are a part of the MA program, more and more MA plans are putting risk on providers in many forms, from light capitation to full global risk. This has a major impact on provider behavior. While the fee-for-service program is beginning to go the route of value-based payments, which look like capitation and risk, and could be leading to some lower spending, the truth is the fee-for-service program remains a heavily transaction-based system. Providers bill for each service. The more they bill, the more they make. But with the growth in MA, it appears that providers' fee-for-service behavior is being impacted as well. As providers see more and more MA managed care lives that focus on cost control and quality, these providers change their behavior everywhere, not only with their MA plan lives, but also with their fee-for-service lives. I would argue not all of them, but at least some or many of them do change behavior. This is what the Elevance Health Study researchers call a spillover effect. I call it the halo effect of managed care on the fee-for-service world. It is important to note that this is not just on the cost control front, but also on MA's drive to better manage care and improve quality. In addition, MA tends to better impact social determinant barriers to health through various interventions too. The lower spending trend due to MA growth is most noticeable in Midwestern and Southern counties, but weaker in Northwest and Western counties. Part of this makes sense. For example, the Dartmouth Atlas, which tracks Medicare expenditures around the nation and documents differences, finds huge variation in Medicare costs across regions. In one area, per capita Medicare costs can be more than double others. But it doesn't change the fact that as MA is introduced in great penetration in these areas that tend to spend the most in the Medicare fee-for-service program, we are seeing that spillover or halo effect. Fee-for-service costs are growing at reduced rates compared to when there was less MA penetration. With that, we'll take our last break and we'll come back for a quick conclusion.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We've been talking about MA challenges, what could happen in a Trump 47 administration to MA, and we talked a little bit about a study that shows MA's true value. I think it's important really to reflect on it. As I've indicated, it really counters all of the negative headlines from opponents of MA that says somehow MA is costing more money due to overpayments. I do think there needs to be some reimbursement and risk adjustment reform, but what the study is showing us is that beyond the fact that bids are lower for basic fee-for-service benefits when MAs bid each year, it also shows the spillover or halo effect that MA growth has on fee-for-service costs. Providers, as MA grows in a given region, tend not only to change their behavior for MA lives, but they also change it for all their fee-for-service lives as well. And the Elevance Health Study shows that Medicare expenditures growth has slowed and there is savings in Medicare fee-for-service as well as in MA. So I think this is a blockbuster study that should be used to lobby Capitol Hill and CMS to ensure that rates are adequate in MA and that too much is not done. Having some reform to reimbursement and risk adjustment is not unreasonable, but going way too far could really kill the value proposition of MA for people that enroll in the program, but also lead to greater expenditures in the fee-for-service world too. So using the Elevance Health study, as well as some key Better Medicare Alliance studies that show greater outcomes in MA compared to fee-for-service, should really be the playbook of the industry to defend MA moving forward. With that, we'll conclude this edition of the Healthcare Labyrinth podcast, and we'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.